I mean, I haven't particularly looked at Southeast Asia, but if you look at the minorities in population in the UK, that's what we call as the black and ethnic minority population. So that the morbidity and mortality data from the UK suggested that people with the black backgrounds are about at least 4 times have got a higher risk of severe COVID disease or death due to it. And then when it came to the South Asian population, the people, especially, they are at least 2 or 3 times the high risk of the severe disease or death due to COVID. And then when we look at the diabetes subset, especially people with South Asian background, if they've got diabetes, they seem to be at least 10 years younger. So when they kind of die due to COVID, so their risk is at least 2 to 3 times higher than the majority population in the UK. And the obesity didn't seem to be a bigger factor when compared to diabetes. So it is not just diabetes plus obesity, it is a diabetes itself. So it seemed to be increasing the risk in the South Asian population. So whether it is because, the marker of diabetes that was used in these studies, which is BMI, so whether the obesity starts at the lower BMI, so in this South Asian population subgroup. There are some data from India and other studies prior to COVID to say that a BMI parameters that is used to define obesity, so in the general population, may not apply to the Indian subset, at least. In that, the Indians tend to accumulate, the South Asians tend to accumulate more fat around their abdomen, which may give them obesity or all the complications related to obesity at a lower BMI, compared to the standard definition of obesity that is used. That's something I think will evolve as people start to look more closely into those aspects.